the child is not, some people might say, oh, the fathers, people are slow and others. But by the 6th month, 7th month, you should just kind of face the reality. If you go to the doctor, for instance, well, I didn't have the history of my daughter. Like, my daughter is adopted. So by the time the doctor asked me what happened at birth, sometimes certain things happen at birth, like maybe the child came out, the child did not cry when it's supposed to cry. And doctors say that that first cry is very important. It means the child is breathing. So if you have that history, sometimes you may have forgotten. So you now recall that, okay, this baby didn't quite cry or when they're supposed to cry. Or sometimes the child had jaundice at birth and is not properly managed. So the doctors will now say, okay, after I've taken the history, in my case, there was no history to take anyway, in my own case. So the doctor just said, this child has cerebral palsy. Of course, that was jaw-breaking. I never heard the word. And the way he said it, I just knew that it's something very,
serious.
Yeah, very serious. So, actually, it's a serious issue because it's not curable yet. People are spending a lot of money trying to find the cure. But like I said, there's a God factor to it. And I said that maybe God has a reason why he's keeping the cure to himself yet. So these are, I think, just the basics.
Now, tell us what it is. What have you faced? What is that challenge that you faced? Taking care of your daughter and the others that you have at your center.
Okay, usually every mother has a dream in fact, once you are pregnant, you have a dream for your baby. In my own case, when I adopted, I have this dream, maybe we'll go to Harvard, maybe we'll go to this. And suddenly you have a baby that is not even sitting down yet, So there is that. First of all, after the dinner, get very angry, maybe at God, at people. And then, in my own case, I got to a stage where what I call the bus stop of acceptance. So by the time you've accepted, you begin to understand, to study the condition. And then you look at it and be very honest to yourself, and that's okay. Again, depending on the severity, some children are mild. You have children with CP who are lawyers, who are doing very well, doing PhDs. They have those who may not be able to do anything. That's how God has made it. That's the way I look at it. Because if a child is severely affected and maybe the child is having seizures, if the child is having seizures, that means that each time a child has seizure, there's a further damage to the brain. And of course, you are managing the seizures with all the side effects. So in my own case, my child came, I like to say, it came with all the toppings. Like when you buy ice cream, you have all the toppings. It came with all the toppings. But in that case, it just made me, to understand the condition more. And that's what has placed me to where I am. My child, I couldn't place my child in a school 13 years ago. Of course, we are not talking about cerebral palsy like we are today. So I couldn't find a place for her. And like they say, if you can't find what you are looking for, you create it.
You create it. You create the future you want.
Yes. So when I found out that, I couldn't put my child anywhere, and the first place I took her to, and they said that they are not going to take her. That other mothers will start withdrawing their children. And as my child got older, I found out that the child may not be able to function in a regular school. So there's no point in wasting my time. So what next? I met a lot of families who were having the same challenge I was having. And I'm a single mom. I have to think of the future. So I decided to have a place where children like my daughter will be managed. And they say like attracts like. So I found out that most children I have in my center, practically all the children in my center, most of them are on that level 4 and 5 spectrum of cerebral palsy. In cerebral palsy classification, there's what they call gross motor function classification system. And 5 is the severest, followed by 4 and others. So most of them are on that level 4 and 5. And incidentally, all of them have seizures too. So I like to say that I got the very difficult one, but then it has made me to understand the condition much better and to be doing what I'm doing.
Yeah, when